Myself, Dr. Venkat, working in the capacity of Senior Lab Director at Medgenome Labs. So the next generation sequencing and microarray, the integration of these two techniques have been very useful in improving the diagnostic yield for the clinical setup. To give an example, so we have detected a deletion, exon level deletion in mother, and then we wanted to check whether this deletion is present in fetus. For the cost effective techniques we wanted to select, we selected microarray and then microarray exon array method, which detected this exon level deletion in kid also. So this way we could actually get the better diagnosis using both NGS technology and microarray in this mother and child setup. Yeah, coming to the reproductive genetics, the use of microarray technology is definitely increasing the yield of diagnosis. For example, earlier the karyotyping analysis used to be the gold standard method, where the karyotyping results sometimes will be normal, but still the phenotype is existing and the disease is existing, so we need to further explore, and then this is where the microarray technology is helping us in increasing the diagnostic yield. When microarray is done on such cases of normal karyotypes, the microarray picks up some CNVs which improves the diagnostic yield, so that we know that there is some genetic abnormality associated with the disease. So with this, there is a lot of scope for putting the patient on treatment or any other rehabilitatory activities required. Challenges what we are facing in the lab. So initially we started with karyotyping and fish test. So where the normal rate was higher, normal result rate was higher, maybe close to 90% in case of karyotyping. And then this is when we wanted some technique which will improve our diagnostic yield. And microarray was actually very much helpful when we implemented this technique in our lab. The diagnostic yield improved, and then the normal rate in karyotyping, which was higher, we could get some results in microarray. So around maybe I can say 15 to 16% or close to 20% increase in the yield, which will be benefiting the patient and then the clinicians as well. The future of reproductive medicine will have more benefits with the advanced techniques like NGS and microarray. For example, starting from the preconception PGT-A, PGT-M. So the PGT-A can detect aneuploidies in embryo level, so that genetically good embryo can be implanted. And then PGT-M, wherever disease is running in the family, so the family can go for PGT-M and select embryo which doesn't have that genetic makeup for the disease. And once preconception is done, coming to the prenatal setup, the biochemical markers have high false positivity, whereas the NGS technologies like NIPT can give better results. So with high sensitivity and specificity can reduce the positives and false negatives, leading to better outcomes. And also, once there is high risk pregnancy, going for microarray technique rather than the technique like karyotyping and fish will yield more diagnosis, especially in setups like where culture failures and other things are observed. So this microarray technique as a confirmatory test can give more result. So this way, with the advanced NGS and microarray, I can tell that there is a lot of future benefits in reproductive medicine than the existing ones.